The Community Care Access Point helps older people and individuals with a disability to remain living in their own home for as long as possible by providing access to services to help them stay independent and undertake daily living tasks. The Community Care Access Point is a centralised access, information, assessment and referral gateway for people seeking community care support services and is a joint New South Wales and Commonwealth Government initiative. It simplifies access to a wide range of community care support services, including transport, meals, personal care, assistance with housework, respite services, home modifications and other care support, all through a single telephone call.
At the access point, lots of people from all different ages, ethnic groups, Aboriginal and Torres Strait Islanders, carers call us requiring assistance to help them live safely or maintain living independently in their own home. And what we do, we assess the client and see what needs we can identify, and then we send off referrals for the service providers.
Different situations, different people ringing through all the time, lots of stressed families that are ringing up for their parents, and the good thing is that we're just one number, so they're not having to then ring a whole range of services to get what they need.
What we do here is to continue to enable independence for people, and it's to reduce them from being admitted to a nursing home prematurely. Now, we refer to over 80 service providers, and 75 of those providers are directly funded by the Commonwealth Government or State Government.
Well, the Community Care Access Point is very hard to describe because it was so subtle I didn't even realise it was happening. They just asked me a few questions and I answered a few questions, and next thing I know I've got all this help and care and everyone around me. I was just absolutely amazed, at the care I had.
If you or your family or carer think you need help at home, please contact the Community Care Access Point on 1300 731 556 to speak to an assessor. The assessor will discuss with you your health and well-being and your ability to perform daily tasks. This will allow the assessor to determine your eligibility, priority for assistance and the supports required to best meet your identified care needs.
Well, the Community Care Access Point, I think it's wonderful for clients because it's a one-stop shop for them to go, a place for them to go to, so they only have to tell their story once.
Well, one of the things I haven't said yet is I have Parkinson's disease, so you find it very hard, to lift your feet up and walk around. They put rails up in the bathroom so I could hold onto them when I was standing up, because sometimes, your legs just don't want to hold you up. And they'd put a lift in. They just built it, put it in, no fuss, no bother.
If you prefer, you can also contact a local community care provider, your doctor, or if you're in a hospital, speak to a social worker or discharge planner who can contact the access point on your behalf. A Community Care Access Point assessor will then call to speak with you or a family member about your care needs.
Yeah, people are happy that they can get a service now and they didn't know they could previously. They didn't know that they could get transport, Meals on Wheels and all the other services, social support. So yeah, they're very happy that they can receive another service as well.
Daniel has a diagnosis of an autistic disorder, which he had since he was 3 years old. Now he's a teenager. So with the community transport in place, it's it benefits everybody because firstly it helps Daniel with his independence and it gives him access to social opportunity at teen time, and for me too because it also provides me with a day's respite, so everybody's happy and it's good for me to see him thriving and his needs being taken care of.
Well, I think, you get so many little bits and pieces of letters and things about helping the aged disability people. And my friend Tony said, well, you should ring them up. Wasn't that the way it went?
I think so, and also then the occupational therapist
came
out and looked at the home.
That's right.
Yeah.
I'm just glad I've got the help from Phil and this lady and whoever comes to see me again, if they're game.
The number of people that say to you, I didn't know this service existed. Wouldn't it be wonderful if they knew that every service existed and all it was one phone call?
If you need help at home and you're an older person, a person with a disability, or you're a carer, call the Community Care Access Point on 1300 731 556 today.
Look, I would recommend, because of what they did for me, I would recommend that to just about anybody who has a problem. I tell them to ring up the access point.